Over the years, you've heard me ask wealth manager Warren Ingram the big questions. How do we invest wisely? How do we protect our family's future? All those conversations, that entire library of financial expertise is now available as a podcast. Straightforward advice to help you build your wealth on demand. Just search for Warren Ingram's Personal Finance wherever you get your podcasts.
702
Health and Wellness.
It's 23 minutes now before 12 o'clock. Let's get into our health and wellness feature now. And as I said earlier on today, we are discussing hepatitis. Yesterday marked World Hepatitis Day, the day used to shine a light on a group of viral infections that often go unnoticed. And in South Africa, in fact, we have made great strides in the testing and treatment for HIV, TB, HPV. But hepatitis still flies under the radar. Types B and C are responsible for about 1.3 million deaths globally each year, with over 2,000 of those in South Africa. And tragically, many people don't even know when they're living with it. So hepatitis can be treated and even cured in some cases. All it takes is a simple blood test, and South African clinics, in fact, already have the right tools. What questions do you have about hepatitis? Do you know a lot about it? Have you ever tested positive for hepatitis, and how have you dealt with it? How have you treated it? 011-883-0702. WhatsApp's on 072-702-1702. Dr. Pelly Malebe is a molecular genetics expert at Roche Diagnostics, who's joining us on the line now. Dr. Malebe, thank you for making time for us. Good morning.
Good morning, Clement, and good morning to your listeners at home, work, and on the road.
So for those who may not know, what exactly is hepatitis, and what is it, and how do the different types, whether it's A, B, C, D, and E, how do they differ from each other?
All right. So hepatitis is simply known as inflammation of the liver. And this can be caused by various viruses. The one virus is the hepatitis, and it's been categorized by 5 genotypes. So it's hepatitis A, B, C, D, and E. It's simply known as that. Hepatitis A and E is contracted through ingestion. So ingesting food where whoever prepared it has not really cleaned their hands. There's been fecal matter passed on, not cleaning your hands after the toilet, or even drinking water that is contaminated with fecal matter, or not washing your hands after changing a diaper and then going on to eat. That's one way of contracting hepatitis A or E. And then the most dangerous hepatitis and the most prevalent hepatitis that we are seeing in South Africa is hepatitis B and C. And that is contracted through blood, so sharing of razors, sharing of needles, and it is also through bodily fluids, so through sexual intercourse.
Okay. So, hepatitis, we are often told that it's often referred to as a silent killer. From a genetic or medical standpoint, why does it go undetected in so many people?
Sure. I think the first route that I would say why we use the word silent is in the way there's no noise around it. Last year, Roche Diagnostics did a survey across the globe around hepatitis, and it was found that many South Africans don't know what hepatitis is, and those that do know think that it is not risky. And then when we look at the numbers, South Africans, 3.5 million South Africans have hepatitis B, and then 400,000 South Africans have hepatitis C. Of those South Africans, 80% don't even know that they are infected. We also have 2,000 deaths within our country per year. So when you look at the numbers that are being called out around this illness versus the awareness, it's going by silent. And this is even just leaving out how silently it affects you. When you're infected with hepatitis B or C, in the very beginning, it is asymptomatic, so you don't have any symptoms, and you yourself are able to continue to spread it. And only later on, if it doesn't clear naturally, you may then develop liver disease or liver cancer. And there's the silence in the word.
Okay. And then, so there are certain people then would you say that are genetically more susceptible to the chronic hepatitis or complications like, as you say, liver cancer?
So contracting hepatitis B or C, we are all at risk. It's not necessarily due to your genetics. It could be due to lifestyle.
Yeah.
It could be just being exposed to hepatitis B or C by being exposed to blood. Doctors, for example, work in the hospital or when we work in the lab, we're expected to take the hepatitis B vaccine because it is that there is a risk of contracting it. Then there comes a point where most people who contract hepatitis B or C would clear it, but there's a 25% population that would not clear it, and this would then progress into liver disease or chronic hepatitis or even liver cancer. And the factors that make those 25%, it is due to genetics and environment and immune system.
Okay. And then are certain people, so there are no people that you would say are genetically more susceptible to that, okay, as you say. We already have the diagnostic equipment for HIV and TB. Can you please just explain to us how these platforms can also be used to test for hepatitis B and C? Can we do that at home?
That's a really good question, Clement. So across the board throughout South Africa, the government has been really, really good in having HIV being tested and treated. And then on a large scale of your viral load and EID testing platforms within the large hospitals and even collection sites and smaller clinics where it's taken to the larger laboratories, there exist molecular instruments. These are the genetic instruments that test the actual disease. Currently, they are sitting there testing HIV, and there's been the inclusion of TB, and more recently, the inclusion of HPV, which causes cervical cancer. What this means is that our country doesn't necessarily have to invest in larger infrastructure because the infrastructure is there. Our country just needs to open up these platforms to a wider menu and include hepatitis B. The machine is there. All you need is the test. And because we have such a good track record, we've learned so much through HIV, and the health system is there through HIV from the point of diagnostics through to treatment. We just need to latch on hepatitis on the existing platform.
All right, I've got some questions coming through from some of our listeners on 011-883-0702. That's where you can call. Let me start with these ones that are coming through on 072-702-1702. Anonymous says, "Hi Clement, I have been diagnosed with hepatitis B and I need some help. Is there somewhere I can go so that it can be cured? I'm living in fear." That's a question there from Anonymous. Dr. Malebe?
Yes. Thank you so much. And firstly to Anonymous, my heartfelt thoughts are with you. What I would like to say to you is this is not a death sentence, so do not live in fear. That's first and foremost. Being diagnosed, you're actually one of the few in South Africa. Many people are living undiagnosed. And that's why there's a call for people to get screened. Don't wait for symptoms. Just go in, go to your nearest hospital, go to your clinic, go to your private doctor and ask to be screened for hepatitis B or C, because this isn't something that is offered immediately. You have to use your own voice and alert your doctor that you want to be screened in order to save your life. And then Anonymous, back to your fear around the virus. Not everybody that contracts hepatitis B will lead to death. But what I would say is definitely go and get treated. In the absence of treatment, you are putting your liver at risk. There is treatment. Hepatitis B treatment is antiretroviral. It's the same ARVs that an individual would take if they were HIV positive. Unfortunately, hepatitis B will not clear from your system, but fortunately, in the presence of ARVs, and if you continue your treatment, your chances of regaining your health and relieving those symptoms are quite high. You're able to suppress the viral load, the hepatitis B viral load. And then I'd also like to use the moment now, in case anybody out there is wondering about hepatitis C or is positive for hepatitis C. Hepatitis C is curable. So if you test positive for hepatitis C, please speak to a healthcare practitioner. They will put you on treatment, and after a few weeks, that hepatitis C will pass through your system and you'll be clear.
Got it. All right. Another question here says, hi, Clement. I have lupus. Recently, my doctors have detected possible autoimmune hepatitis. Please, can you ask your guest to explain what exactly this is and also the consequences?
Yeah. So, as I said, Clement, and your listeners are asking really, really great questions, and I think it's great for the public to also learn more about the disease. Initially, in my statement, I mentioned hepatitis simply means inflammation of the liver. And then the virus, there are different ways in which an individual can get hepatitis, the disease. The first is these viral infections that we mentioned, hepatitis A to E. The other could be through chemical consumption. So excess alcohol consumption can cause your liver to be inflamed, and therefore also cause liver disease, and also through medicines and chemicals. And in the case of the listener that's asked the question where it's autoimmune, in that case it means the body is almost turning on itself and attacking the liver, causing the inflammation of the liver.
Okay. It's 12 minutes now before 12 o'clock. I'm going to take a quick ad break. When we come back, we'll wrap up the chat with more of your questions. Keep them coming. You can send a WhatsApp voice note or give us a call.
Over the years, you've heard me ask Wealth Manager Warren Ingram the big questions. How do we invest wisely? How do we protect our family's future? All those conversations, that entire library of financial expertise is now available as a podcast. Straightforward advice to help you build your wealth on demand. Just search for Warren Ingram's Personal Finance wherever you get your podcasts.
702 Health and Wellness.
9 minutes before 12 o'clock, we've been talking about hepatitis this morning on our health and wellness, and we've got some of your questions coming through on the WhatsApp line.
Hey Clement, great show. I think the other thing that we need to also expand on is to let sports people understand the use of steroids impacting the liver. And this is what's happening. I think we don't talk much about it, and maybe your guest can expand more. And so that people, especially young people getting into using steroids, especially the ones that are taken orally, they'll end up in the liver and everything other thing. This is Simon in Veldefien Park.
Thank you, Simon. Dr. Malebe, you can respond to that, and then I'll play another voice note afterward.
Yes, I think that is also great to bring to the party the many ways in which we can develop liver inflammation and thus hepatitis through chemical use, through drug use, and steroids as well.
Okay, here's another one. Okay, we'll come to that in a moment while Abel prepares it. So there was a question here about testing as a routine part of health screenings. Why don't we have that yet in South Africa, especially when technology already exists? Do you think that would assist?
I think that's a brilliant question. And we've seen this taking place in other countries. It would be great for South Africa to expand. When you're going for your health check, when you're doing your HIV, you incorporate hepatitis. I'll use mothers as an example because one of the ways in which hepatitis B can be transmitted is from mother to child. And within the private sector, they are screening in the first trimester for women to test if you have hepatitis B. And if you test positive, they will then inject your child with the vaccine on the first day, within 24 hours, so that child does not develop hepatitis B. It would be great as well if this could be done in the public sector. What we're seeing in the public sector is in government hospitals and clinics is that they are screening for HIV and syphilis within pregnant women, but they have not yet incorporated hepatitis. So talks like these, sharing awareness, being a voice, does help to change policies and country guidelines. Just to use countries that have gone ahead and incorporated mass screening within the public, I'll use Egypt. I always like to use countries within our continent and not look too far to show that it's doable. Within Egypt, they did a mass screening. They started in 2018 where they had a prevalence of 22% of the population had hepatitis C. They did mass screening. They screened over 60 million people. And by now, in 2025, there's a prevalence of less than 1%. So they are well on their way of eliminating hepatitis C. And we can replicate that. We can do mass screenings and give the people that require the treatment the right treatment. This also helps limit the spread, because if you know that you've tested positive for hepatitis B, you also change your lifestyle and contain it. We saw this with COVID. We've seen it with HIV. Back in 1995, an HIV positive test was a death threat. It's no longer.
Yeah, someone else was asking, hi Clement, I'm sorry if this is a stupid question, but I don't know much about hepatitis, but I see a lot of people link it to sexual intercourse. Is that the only way you can get it?
That's a really, I'm loving the questions coming through here, because they're showing that there's a lot of attention. And what I like about that question is it brings in the term stigma. There's a lot of people, why we don't talk about hepatitis when we test positive is because it is assumed that you've gotten it through sexual intercourse and therefore you are promiscuous. It takes us back to where we were back in 1995 when HIV was first a thing and it was spreading. HIV testing was first a thing and it was spreading, and there was the stigma attached to that. You can get hepatitis B and C through sexual intercourse, but that is not the only way. As I said, you get it through blood, and you also get it through bodily fluids. You get it through sharing razors. You get it through sharing needles. Previously, before blood was being screened for hepatitis, people were contracting hepatitis B and C through blood transfusion. So an individual would have gotten in an accident and received blood and contracted hepatitis B and C because it was not being screened. But through developments and diagnostics, this is no longer the case. Every single blood that is being transfused into another individual has been screened for all infections beforehand.
Yeah. Well, Dr. Pelly Malebe, thank you so much for making time for us. Molecular genetics expert at Roche Diagnostics. Thank you so much for making time for us. It's now going up to 3 minutes before 12 o'clock.